Now, Robert, you mentioned that you could use this every day. And if you were to, let's say, purchase this, use it for a home use, how frequently should you use it? Just because you can use it every day doesn't mean sometimes you should. So what are we looking at as far as the frequency of use at home, and for how long would you say? Is it different for every person, or is it somewhat, standardized?
Yeah, of course, it depends a little bit on what you are using it for. For example, I, as a mostly healthy person, I use it mostly in the evening, sometimes for stress relief. So maybe every other day, maybe 2 or 3 times a week in total. But for someone who's maybe has a danger to get dementia, for example, or where already the cognitive function went down, there it's of course beneficial to use it every day. Or also when we look at depressive people, as long as the depression is in an acute stage, I would recommend using it every day for half an hour. But of course, as soon as you stabilize the situation, you can keep on going like maybe every other day, or also 2 or 3 times a week.
Yeah, I'm glad you brought that up, because, a lot of people listening may not be in a chronic disease state, or may be out of it already, let's say, but still have. I think everyone today suffers from a little brain fog. I think everyone today, if you watch enough news, is going to suffer from a little depression and fear, correct?
Yeah.
I mean, it's everywhere. What can, and I'll direct this at Robert, and maybe Jennifer, you could go afterwards as well, but what can people expect when they use this? Because everyone can expect, if they take an antidepressant, to feel something. It does something. It's a chemical, it's a drug, it's powerful at times. Doesn't mean it's good or bad. Sometimes you could expect suicidal thoughts off, antidepressives. But what can they expect from using the Weber helmet?
Yeah, you're right. Especially when we talk about this topic like brain fog, or you really feel stressed in the evening. That's usually something people feel right away. When you really sit down, we usually recommend then doing it in the evening and not watching TV or look at your phone or whatever. More like go into a meditative state and really relax, use the helmet for 30 minutes, and then you really feel it, the stress relief, you feel the brain is clearing up. That's usually the feedback we get from almost every patient. And that's just a great feeling, especially when you do it in the evening. All the people are telling me they can sleep better. They just feel better, because, it's also stimulating your serotonin, dopamine levels and everything. So there is a very strong general effect, even if as you said, even if you're not in an acute stage of disease.
Jennifer, I'm going to throw this question at you now as well. And what are patients experiencing? What are they telling you about symptom relief or improvement with their brain function?
I would actually back up and follow what Robert said. We do the same thing when people come to us with severe depression or just unable to sleep. We ask them to utilize the helmet more of a meditative state, not to get too much distraction, so that the body can actually absorb it. People that are very much on the go and just looking to, get some extra energy will do it while they're doing work or something, right? Which is not the best case. We want our bodies to have the chance to heal. One thing that we also integrate with the use of the helmet is a formula that actually Weber Medical put together, which is a bioavailability form of green tea extract. So a lot of the depression cases that we have come in will have green tea extract about an hour before, and usually in the evening, and do about a 30-minute session at night. And as Robert said, it increases serotonin and dopamine just from the light therapy, but it also improves oxygen availability and oxygen consumption. Light therapy in general does. So what we'll have people do is practice their breathing while they're doing this, as Robert said, a meditative state. And so far, the responses that have come back is a greater sense of rest or sleep when they do go to sleep. Many people wake up quite frequently through the night. And some, after the first time of using the helmet, depending on how depleted their energy sources are, because we're giving back an energy source to the body. But usually the first day, they will feel a great relief through the night. They'll sleep longer hours and they'll feel more refreshed the next day. Sometimes it takes them a couple days. And other patients who are doing a lot of medications, we've had a few use of the helmet. They have been able to actually start to reduce their antidepressant medications. Now they need to do this obviously with guidance and whatever physician they're doing it with, but many have been able with us to reduce those antidepressants by doing natural supplements and utilizing the helmet, which is for us a huge improvement because we have dealt with people through the years, especially with chronic infection, Lyme disease, that are on so many different antidepressants, anti-anxiety medications, sleep medications, because they just can't rest. Their bodies are just on this over exertion all the time. And the utilization of the helmet in combination with the green tea extract is reducing that greatly. And the reports we're getting back are, my son is sleeping better. The tremors have slowed down. He's not waking up through the night. I don't feel as anxious after I utilize the helmet. I feel calmer. My brain fog's lifted. Even my eyesight feels clear. I can think of words faster. So it's very positive feedback. And it does depend on everyone. Not any one of us are the same. So some may need to utilize it a little bit more. Others may need to utilize it a little bit less. But as Robert and I have experienced, even in many conferences we've worked together with, we have people sit down and do a 10, 15-minute session, and they'll come back to us about an hour later after listening to a lecture. And these are doctors going, what the heck did you do to me? Suddenly I can hear everything they're saying and I'm comprehending it. It's like, well, it was light, you know? So it is quite fun. And I don't want to use the word magical, but it is, because it's nice to see that people are getting a physical, biological response. But a lot of them are coming back with eyes of not believing how well that they feel after utilizing something like this.
Well, it's utilizing advanced technology in such a simplistic fashion, and it really makes sense to me, right? This idea of using photobiomodulation, which has so much research behind it, so much science, and applying it to the one region where a lot of people are unfortunately a little bit off there and have trouble with their brain fog, with cognition, with sleep, which we sometimes forget to associate with the brain, even though it really is a neurological and chronobiological issue.